Introduction. Meniere's disease is a disorder of the inner ear characterized by episodes of vertigo, fluctuating hearing loss, a ringing sensation in the ear called tinnitus, and a sensation of fullness in the ear. In most cases, only one ear is affected. The disease typically starts between the ages of 20 and 50 years and is usually chronic. It is slightly more common in women and may run in families. Causes. The inner ear is made up of an outer bony labyrinth and an inner membranous labyrinth. The membranous labyrinth is filled with fluid called endolymph. Perilymph fills the space between the bony and membranous labyrinth. Movement of endolymph stimulates nerve receptors that send signals to the brain so we can perceive sound and maintain balance. The main pathology in Meniere's disease is distension of the endolymphatic system due to an increased volume of endolymph. This increased volume may be due to increased production of endolymph, or its inadequate absorption, or both. Distension of the membranous labyrinth leads to its rupture and mixing of perilymph with endolymph, which is thought to bring about an attack of vertigo. Meniere's disease may occur due to genetic reasons, an anatomical defect, trauma, an autoimmune condition, an allergic reaction, or a viral infection such as mumps or herpes in childhood. Signs and symptoms. People with Meniere's disease complain of episodic attacks of vertigo, tinnitus, hearing loss, and fullness in the ear. The length of the attack is variable, with most episodes lasting 2 to 3 hours. Vertigo is a spinning sensation that usually worsens with movement of the head. Hearing loss and tinnitus may become more obvious as vertigo subsides. Following an attack, some patients fall asleep or may complain of lightheadedness or motion intolerance. Hearing loss is typically fluctuating and progressive. Tinnitus is louder in the initial phase of an attack, then becomes softer as hearing improves, but may later be present even between attacks. 2% of patients have a variant of the disease in which they experience a drop attack, a sudden fall to the ground without vertigo or loss of consciousness. Diagnosis. To diagnose Meniere's disease, your doctor will review your symptoms and medical history and perform a physical examination. An audiometry or hearing test is conducted to assess your ability to hear sounds at different volumes and pitches. Your sense of balance will also be assessed. A few special tests may be performed, such as video nystigmatography, a test that evaluates eye movement to determine problems with balance, electrocochleography, a test to measure the electrical potentials of the vestibulocochlear nerve in response to sound stimuli, vestibular evoked myogenic potentials, or VEMP, that evaluates the characteristic changes in the affected ear resulting from Meniere's disease, and posturography, which assesses the entire balance system, including inner ear function, vision, and tissue sensations. Imaging tests such as a CT scan or MRI may also be ordered. Treatment. There is no cure for Meniere's disease, but treatment can help minimize symptoms. In cases of an acute attack, bed rest is recommended with the head supported by pillows to prevent excessive movement. Your doctor will provide reassurance and explain the nature of the disease. Medications are administered to relieve vertigo and nausea. A diuretic helps prevent fluid retention and may be prescribed to reduce the severity and frequency of attacks. Your doctor will recommend that you observe a low-salt diet, stop smoking, and avoid excessive water intake. Tea, coffee, and alcohol should be minimized. Avoid activities that require an acute sense of balance. A vestibular rehabilitation program may be recommended to improve balance through specific exercises. Hearing may be improved with the use of a hearing aid. Your doctor may recommend a Meniere device to reduce vertigo. This device can be used at home and improves fluid exchange by applying pressure to the middle ear through the ear canal. If vertigo attacks are disabling and not controlled by lifestyle changes and conservative measures, surgical treatment is considered. Gentamicin, an antibiotic which is toxic to the inner ear, may be injected to destroy the part that controls balance. Vertigo is improved as the other ear takes over the balance function. The sac containing endolymph may be drained through a shunt to relieve pressure. The vestibular nerve, which controls balance, may be dissected on the affected side, while the hearing nerve is preserved. Ultrasound may be used to destroy the membranous labyrinth controlling balance. Summary: Meniere's disease increases your risk of falls and accidents and can adversely affect your life and overall functioning, causing stress, fatigue, and anxiety. Although it cannot be cured, there are various treatments to help relieve the symptoms and improve your quality of life.